Hello, this is Dr. David Greene, CEO of the Mid-Atlantic Pain Network. Today's topic is the basics of migraines. A migraine is a chronic headache that affects people from a few hours up to 72 hours straight. It's a complicated, recurrent headache disorder. It's most common in women and those between the ages of 15 and 55, and most become less severe and less frequent with age. It affects 18% of women and 8% of men. 30 million people in the U.S. have at least one migraine per year. Every 10 seconds, someone in the U.S. goes to the ER with a headache or a migraine. 70% of individuals have a first-degree relative who suffers. If one parent has migraines, there's a 40% chance a child will suffer. And if both parents suffer, then the chance goes up to 90%. Over 90% of sufferers are unable to work or function normally during their migraines. There's a lot we don't know about what causes migraines. We know that it has to do with genetics and environmental issues. We also know there's an imbalance in brain chemicals, such as serotonin levels dropping during migraines. Low serotonin, which is a pain management chemical, can trigger a migraine by letting too much blood flow through vessels that should be constricted, and that can induce a throbbing sensation. So typical migraine triggers may include various foods such as aged cheese, red wine, beer, whiskey, food additives, cold foods, citrus fruits, MSG and caffeine, elevated stress levels, barometric pressure changes, strong scents, hair accessories, and various forms of exercise. Poor posture, skipping meals, smoking can spark up migraines. The small silver lining in all this is that there's no evidence to clearly substantiate that chocolate is a trigger of migraine headaches. It is a myth, thank God. All right, symptoms of migraines often include a unilateral head pain that is throbbing and aggravated by activity. An aura is a visual or sensory symptom prior to the onset of the headache. This may include photophobia or visual scintillation. 80% of migraines have no aura at all. Diagnosing migraines, there's really no objective test available. Physicians will often get a CT or an MRI to rule out badness, such as tumors that can cause similar symptoms. A lot of it's diagnosed on patient history and pattern of symptoms, and a migraine diary can be very helpful. So in making the diagnosis, the International Headache Society requires patients to have at least 5 attacks, fulfilling 3 of these criteria: 4 to 72-hour duration, at least 2 of these unilateral, pulsating, moderate to severe pain intensity, and aggravation by or causing avoidance of routine physical activity, and at least 1 of these, nausea plus or minus vomiting, or photophobia and phonophobia. Abortive treatment options are those that are given when a migraine's already started and you're trying to abort it. This includes triptans, which target serotonin levels, almotriptan, called Axert, elatriptan, called Relpax, frovatriptan as Frova, naratriptan as Emerge and Naramig, rizatriptan, sumatriptan, which is the most popular one, and zolmitriptan. Additional abortive treatment options may include Migraine, dihydroergotamine, which is a nasal spray, ergotamine tartrate, known as Cafrago, and over-the-counter medications such as Advil migraine, Excedrin migraine, and Motrin migraine, for instance. Drinking caffeine can also help. Additional options may include narcotics, barbiturate medications, anti-nausea medications such as Reglan, Compazine, and Phenergan. Then you also have preventive treatment options, and these are designed to help reduce the severity and frequency of migraines when they occur. High blood pressure medications are often used off-label for this, beta blockers and calcium channel blockers. Antidepressants are also often used off-label, including amitriptyline and nortriptyline. Anti-seizure medications, same thing, off-label. This may include Neurontin, which is gabapentin, Topamax, and Depakote, and then Sonomagran is a serotonin antagonist. There are various interventional treatment options which have been a great advancement in migraines. FDA has approved Botox injections for chronic migraines. These are administered at 3-month intervals. An injection includes about 10 minutes. It's 32 injection sites, but it's pretty quick. They are covered if certain medications have been tried and failed. For chronic migraines, it's a distinct and severe neurologic disorder characterized by patients who have a history of migraine and suffer from headaches on 15 or more days per month, with headaches lasting 4 hours a day or longer. The big study that got the FDA to approve this showed patients treated with Botox averaged 8 to 9 fewer headache days per month compared to baseline, as demonstrated in the preempt study. Additional interventional treatments can consist of occipital nerve blocks, cervical facet injections, cervical epidurals, sphenopalatine ganglion blocks, supratrochlear blocks, supra and infraorbital nerve blocks, and then if an occipital block works and wears off, then a pulsed radiofrequency energy can be very, very helpful. There's also a transcranial neurostimulation procedure, which you can discuss with your pain doctor as a last resort. Now, looking at nerve blocks, in a study of 100 patients getting occipital nerve blocks, over 50% achieved pain relief averaging 3 weeks. There was a retrospective study on the efficacy of greater occipital nerve blocks in those with refractory migraines. They used numbing medicine and steroid, and 54% of migraine patients reported great results up to 6 months. There was another study looking at peripheral nerve blocks in the treatment of migraines, such as occipital nerve and supraorbital nerve blocks. This was 85% effectiveness rate for 6 months, but as you can see, it was often more than 1, 2, 3, 4, 5, up to 10 injections necessary. The top non-operative pain management in the Mid-Atlantic region is through the Mid-Atlantic Pain Network. There are many clinics throughout the area accepting over 50 insurances and providing over 25 treatment options with the board-certified doctors. Visit us online today at midatlanticpainnetwork.com and then call us for more information and scheduling at 855-444-6585. I'm Dr. David Greene with the Mid-Atlantic Pain Network. Your pain stops here.